Good day everyone, I'm Jessel Mayferrer from BSN3H, and for today's video, I'm going to demonstrate the tracheostomy care. The goal of this procedure is the patient must exhibit a tracheostomy tube and site free from drainage, secretion, and skin irritation or breakdown. We must check for the equipment such as bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit or 4x4 inches gauze pad, sterile cotton tip applicator, sterile tracheostomy dressing, sterile basin, small sterile brush, roll of quill tape or tracheostomy tie, scissors, pulse oximeter, stethoscope, clean gloves, mask, goggles, face shield, hydrogen peroxide, and plain NSS or sterile water. For the implementation, bring necessary equipment to the bedside stand or overbed table to manage the time and effort. Perform hand hygiene and put on PPE if indicated. It is to avoid the cross-contamination. Identify the patient using patient identifiers such as full name and birth date. Close the curtain around the bed and close the door to the room if possible. It is the privacy of the patient. Determine the need for the tracheostomy care. Explain what you are going to do and the reason to the patient even if the patient does not appear to be alert. Good day, ma'am. I'm Jessel Mayferrer from NUST, and I'll be your student nurse for today. May I see your armband, ma'am, please? Okay, ma'am. So I'm here to do the tracheostomy care. May I ask if you have an allergy, ma'am? Adjust bed to comfortable working position, usually elbow height of the caregiver, low side rail closest to you. If the patient is conscious, place him or her in a semi-forward position. If the patient is unconscious, place him or her in a lateral position facing you. Move the overbed table close to your work area and raise the waist height. Check for the lung sounds. Place the towel below the trachea site, covering the neck and chest of the patient. Put on face shield or goggles and mask if tracheostomy has been just sanctioned. Remove soiled side dressing and discard before removal gloves used to perform sanctioning. Prepare basins and cleaning solutions. Mix sterile water or plain NSS and hydrogen peroxide in one basin. Be sure it will be filled 0.5 inches of the basin. Add another plain NSS in another basin that will fill at least half each. And perform gloving. For cleaning the tracheostomy, remove the oxygen source if one is present. Stabilize the outer cannula and face plate of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand. Press the top and release lock. Gently remove the inner cannula and place the first basin with plain NSS and hydrogen peroxide and let it submerge there for a few minutes. Simultaneously, gently slide the tracheopad dressing downward and discard. Check for some exudate or drainage, breakdown, irritation, and inflammation. the inner cannula of tracheotube using prepared plain NSS plus hydrogen peroxide and use brush to remove solidified or sticky mucus. Rinse using the second basin with plain NSS only. Discard gloves and put on another gloves if necessary. Try the inner cannula using sterile gauze or pad. Gently reinsert it back to the tracheostomy tube and be sure it is properly locked. Dip cotton tip applicator or gauze sponge in cup or basin with sterile saline and clean stoma under faceplate. Use another applicator or sponge only once moving from stoma site outward. Pat skin gently with dry 4x4 gauze sponge. Slide commercially prepared tracheostomy dressing or pre-folded non-cotton filled 4x4 inches dressing under the faceplate. Check the fit of tracheostomy collar. You should be able to fit one finger between the neck and collar. Check to make sure that the patient can flex neck comfortably. Reapply oxygen source if necessary. Remove gloves. Assist the patient to comfortable position. Raise the bed rail. Place the bed in the lowest position. Remove additional PPE if used. Perform hand hygiene and document. Reassess the patient respiratory status including respiratory rate, effort, oxygen saturation, and lung sounds.